Hello and welcome to my presentation entitled Empowering Healthcare Recipients Through Patient Portals, My Chart versus Follow My Health. My name's Simon Fink, and this is for Nursing 589 Informatics for Professor Isaacson in June 2025. To begin, why patient portals matter in healthcare. Over the past few years, there has been a significant increase in the use of technology for health management and patient access. There are multiple benefits to integrating technology into patient charting, including improved self-monitoring of health, a deeper patient-provider relationship, enhanced quality of care, and increased patient satisfaction. Overall, patient applications or portals such as MyChart and Follow My Health show promise in improving health outcomes and patient satisfaction with their healthcare. MyChart can best be described as a secure online patient portal that enables individuals to access their health information, view lab results, schedule appointments, communicate with their healthcare team, access billing and insurance information, and request medication refills. This application can be accessed from a mobile device and is available as a downloadable app for cellular devices developed by Epic Systems. Follow My Health is another patient portal similar to MyChart that offers test result management, direct messaging with providers, and appointment scheduling. The key difference here is that the developer is Veradigm, which is managed by Allscripts Healthcare Solutions. Veradigm boasts a single unified vendor that it claims helps ease the use for patients and the financial aspects for providers and businesses. What drove the development of patient portals? Providers have played an integral part in the rise and the adoption of patient portals over the last few years. The past pandemic, which forced countless individuals to remain home due to COVID-19, led to greater use of tools like MyChart and Follow My Health to manage and stay ahead of their healthcare needs. The need to communicate safely while distant drove the innovation of better remote care. Several reviews have demonstrated that patient portals facilitate chronic disease self-management, such as for diabetes or heart conditions, by providing features like secure messaging, appointment reminders, self-monitoring tools, and access to health education. The passage of the Health Information Technology for Economic and Clinical Health, or HITECH Act, played a fundamental role in the adoption of patient portals. It offered monetary rewards to motivate medical professionals to adopt electronic health records and adhere to meaningful use guidelines. Social, ethical, and legal considerations. In some studies, barriers to patient portal access include concerns about data and privacy security. In these studies, some patients expressed concerns about their personal information being protected from data breaches or unauthorized access, which led to their apprehension about utilizing patient portal platforms. The Health Insurance Portability and Accountability Act, or HIPAA, establishes regulations that require the stewardship and safeguarding of patient information, including digital patient portals. HIPAA also requires multi-factor authentication and that any data breaches must be reported promptly. Access to patient portals might differ, and social determinants of health can have a major effect on this. Higher income is strongly associated with higher use of patient portals, as well as those with higher education. Rural areas often lack broadband and internet connections that are more readily available in larger cities, serving as a significant barrier to access. Unfortunately, men, people of color, and persons with disabilities were less likely to use services like patient portals. Studies have revealed that what greatly contributed to disparities was these services not being offered or discussed with certain groups by the provider, not just personal preference or aversion. Usability and patient experience. Ease of navigation is key to any piece of technology. The easier something is to implement, the more seamless it is for the user to integrate it into their daily lives. MyChart was rated a 3.8 out of 5 for objective quality mean score based on the user version of the mobile app rating scale, UMARS. Some of MyChart's strengths include the page's cleanliness, intuitive icons, integration of lab results, and secure messaging. The strengths of Follow My Health are aggregate health records, ease of navigation across devices, and flexibility. Cost and financial feasibility. MyChart is not an independent application and must be integrated with Epic systems. This integration can result in significant upfront implementation expenses because the entire Epic system must be licensed. Follow My Health can operate freely with electronic health records and is subscription based, making it more suitable for smaller practices. User reported feedback and satisfaction. Many customers appreciate the convenience of patient portals. In a study of over 5,000 patients, approximately 98% found MyChart to be valuable for visit preparation. Some participants complained about the limited features and restricted access to historical data. Another study that examined overall portal utilization rather than specifically patient portals discovered that patients who engaged with these services felt more in control, were more informed of their overall health, and were more satisfied with their healthcare providers. Unfortunately, no scholarly evidence exists that discusses customer satisfaction with Follow My Health. However, one unbiased evaluation platform, SelectHub, noted that its limited number of evaluators stated they enjoyed streamlined communication but were frustrated with limited customization and occasional technical glitches. As stated earlier, SelectHub offers valuable insights, but since it is not a peer-reviewed academic source, the data should be considered with discretion. Leadership support and integration challenges. Some vital keys to successful implementation include leadership engagement, training, and integration into daily workflow. Collaboration among leaders is also essential, along with colleagues and even patients to insights while implementing change based on those suggestions. System requirements like those for MyChart and Epic can be technically complex and require substantial resources. The lack of education or training for these platforms can serve as a hindrance to the compliance and adoption of technology integration within the workplace. A difference in digital literacy and access can lead to inequities among communities and hinder the seamless implementation of patient portal services. It is also important to note that portal implementation and integration are ongoing processes that require continual evaluation. Comprehensiveness. Both MyChart and Follow My Health, as mentioned earlier, are comprehensive systems that offer many of the same services. Both provide access to labs, notes, medications, and allergies. MyChart has the capability for real-time updates as it is directly linked with Epic systems. However, this also serves as a drawback as it cannot be used with other systems. Follow My Health features patient-generated data, such as from fitness trackers and uploads. It also works with systems that may span multiple hospitals. Implications for advanced practice nurses. While patient portals can empower individuals to take control of their care, providers can also benefit from these powerful tools. Secure messaging can facilitate freer flowing communication and strengthen trust between patients and healthcare providers, leading to increased patient satisfaction. In some populations, decreased hospital visits can be achieved through increased portal use and the use of tools such as lab results, shared care plans, and education. Patient portals also allow providers to provide faster follow-up and review adherence to care plans, medications, and other medical advice. In conclusion, one may be asking, what exactly is someone to do? Moreover, that is a great question. Providers can begin by actively encouraging all their patients to try accessing the patient portal. Studies show that when providers actively encourage their patients and offer these services, racial disparities and inequities discussed earlier can be avoided. Providers can also share with their patients the attributes of data security, support informed consent, and discuss privacy. Aside from education, proper staff allocation and a clear definition of roles among providers can help achieve better staff engagement with patients and their access to the patient portal. For more information, please see references listed here. Thank you.